My name is Dr. Robert Melillo. I'm from New York. I'm going to be answering some questions. First question, why your book Disconnected Kids appears to be so powerful and successful. I think the key to my book Disconnected Kids and the work that I do is that it started with one question, and that question was, what is actually happening in the brain of a child with ADHD or autism or dyslexia? What is it? And I don't think anybody had really asked that question to that degree that also had a clinical background. I'm a researcher, I'm also a clinician, so my goal is, my focus is neurology and rehabilitation, so it's all about looking at what the problem was so that I could come up with a solution. There were some researchers that were trying to understand the problem, but really not to come up with a solution, more to just understand the problem. So for me, as a professional, but also as a parent of a child that had some of these issues and disabilities, I wanted to know how to change it. And before I could do that, I believed I needed to know what the actual problem was. And even today, when I lecture to professionals all over the world, it's usually the first question I ask. And most professionals working with these issues cannot answer that question at all. So I think the fact that I was able to not only answer the question, but to do it in a way and explain it to parents and to professionals in a way that was simple, even though the problem is very complex. But also, what I hear all the time from parents that read the book is that when they read it, it was the first thing that really made sense to them. That as soon as they read it, they recognized their child. And so it wasn't just about saying scientifically this is the problem, it was then really relating it to their own child. And it really had a very big impact because, as you know, many parents are struggling and suffering, and they're researching and they're looking for answers, and most people feel like they never get an answer, like they are alone. And when they read it, it's the first thing that they feel really gives them an answer that makes sense to them, and it's very empowering to them. And so that can be very emotional, and I think that's a lot of what why the book is so powerful and why it resonates with so many people. I think another reason is because I gave people real practical tools. One of the things I hear from parents all the time is that, you know, although we have brain balance centers in the US that work with these types of issues, what I was trying to do was give the parents real tools that I had developed over 20 years. I wanted to give them all the tools that they could be able to take this and actually help their child on their own without any professional help, because I realized that many people could not get to our centers or could not afford that type of approach. So I wanted to make it something that every child had access to. And I think parents read that in the book. They feel that I'm not just trying to sell a program. I'm not just trying to, you know, talk about what I do. I'm trying to actually give them the answer so that they can use it. And so now, with this book being translated into Bulgarian, I'm very excited, but I have books that my book has been translated into 7 or 8 languages. So this book now, I'm very excited because everywhere the book is translated, I get letters from parents around the world telling me that only using the book alone, they've been able to significantly help their child, if not completely resolve their issues. So I think those are some of the reasons why the book has been so popular. In your book, you identify increase of autism, ADHD, dyslexia, OCD and other neurological disorders as an epidemic. Why? The reason why I believe these are increasing, and actually the third book I wrote was really about what is actually causing the epidemic, but I also wrote about it in this book as well. Again, it starts with understanding what the problem is. There are a number of different questions you can't answer if you don't know what the actual problem in the brain is. So again, that's one of the reasons why I believe that's where it started for me, and that's where all of this work comes from. Once you understand what the problem is, then you can start looking at what could cause that. So the problem in the brain is what I have identified and what other researchers have identified as what we call a functional disconnection. This means that there is no damage in the brain. The brain isn't injured. There's no pathology. There's no genetic damage or mutation in most cases. So there really is nothing preventing the brain from improving other than understanding what the problem is. So the problem revolves around something called functional connectivity. And that's where really all the research has gone in the last 20 years. That the problem is not damage to any area of the brain. The problem is a breakdown in communication between networks, and especially between networks in both sides of the brain. So a problem with what we call hemisphere integration is the primary core problem, where networks on one side of the brain can't connect and communicate and share information and synchronize with other networks. And the reason for that is that one side of the brain is growing at a different rate or maturing at a different rate. And as the brain matures, it becomes faster and the processing speed. And so it's like an old computer and a new computer, where one may have a very fast Pentium processing chip and the other one has a slow processing chip. Both computers work. They're not broken, but they can't communicate or share information. They can't synchronize because they're at different processing speeds. So when areas of the brain are immature, areas of the brain and networks in the brain are slower, and they can't communicate or integrate with other areas. So what we end up seeing in all of these children with all of these issues, the same underlying problem, and we also see what we call an unevenness of skills, meaning that these children are not struggling in all skills. In fact, they may be very good or even very gifted or even at a genius level in some abilities, but they struggle with other basic skills. And this unevenness of skills is representative of an unevenness of maturity of the areas of the brain that control those skills. So what we label as ADHD or autism or obsessive compulsive disorder or dyslexia is really what we're looking at is there are certain skills on one side of the brain that are advanced, and then there are other skills that are delayed. And so the combination of those things produces symptoms like attention deficit hyperactive disorder. The left side of the brain in autism as well is high and very advanced. These children are usually very gifted in their left brain skills, maybe even a savant level where they can remember numbers, or they're very good with fine motor skills, or they have perfect pitch for music, or they have memory that they never forget anything. All of those things are left brain skills, and we see that in children with ADHD and autism, the left side of their brain is actually more connected than normal. And those connections are very strong, so they actually can process information at actually superhuman speeds. But on the other side, the right side of the brain, we see that the brain looks very immature for their age. And this area of the brain is less connected. And the two sides of the brain are underconnected compared to normal or typical developing brains for their age. So we see on the right side that these children have immature skills around nonverbal communication. not being able to read social cues, not being able to understand emotion or empathize, not being able to pay attention or get the big picture, which is what the right brain does. And so this developmental imbalance, what we call a developmental asynchrony, is really at the core of the problem. So once you understand that, you start to say, now why? And why is this happening? And the reason why it's happening is because of a number of different factors. I identified 50 different environmental factors, but they're almost all environmental. Most of them are primarily lifestyle. And the main lifestyle change that's occurred over the last 30 years has been the development of computers and technology, and the fact that more and more people are more sedentary, less physically active. We also see that we have more toxins in our environment that does contribute. We see that people around the world have higher levels of stress hormones and inflammation. And all of these factors really affect the mother and the father before they even get pregnant. This is called preconception. And what it does is it tends to turn off genes or dampen genes. And the genes that are most commonly affected are the ones that regulate what we call functional connectivity, or the formation of functional connections in the brain. So most of these issues really start in the womb or early on in the first 3 to 6 years of life, when the brain is just developing and when the two hemispheres are just developing and starting to connect with one another. And so these environmental changes that are having an impact on our body and our health are actually affecting the development of the child's brain. And these are some of the things as to why we see an increase. For instance, in the United States, 30 years ago, autism was diagnosed 1 in 10,000. It's now diagnosed 1 in 67, or 1 in 42 boys. And that increase, I have shown, is not because we're just recognizing it, not because it's being diagnosed earlier, or because of changes in diagnostic criteria. It is a real increase, where there is an actual increase in children that never had these problems before. And this is happening around the world, and this is another reason why my book is very popular, because it really answers the question as to why it's happening. And then this also leaves open the door for possibly preventing it, which I believe is also something that can be done, that we can prevent the rise of these issues. But the good news is that based on my book and my work, is that even if the problem happens in the womb or early in life, in most cases it's completely reversible. And that's the main thing that, again, I don't think anybody else is really talking about that to the degree. But in the United States, in my centers, we have well over 100 centers that have been around for approximately 10 years. We've worked with somewhere around 70,000 children and families. So this is a big sample that I'm talking about. This is not something where we've just worked with a few kids or a few hundred kids. We've worked with tens of thousands of children, and we've seen tens of thousands of them completely resolved using standard tests. Not everyone, but most. Okay, what are the differences between your brain balance program and other methods of treatment? We're using things that have been around for a while. Physical activities, different types of sensory stimulation, nutritional interventions, behavioral and academic interventions. The uniqueness is the way we use it. And it is the idea of directing it towards the area of the brain and the specific area on the side of the brain that is underdeveloped, that is immature and underactive. And by stimulating that in a what we call lateralized way, we actually can stimulate growth and development. And when we do that, if we correct that imbalance, that corrects the root cause of the problem. And this is really where all the difference lies. And the fact that I'm also combining all of these other methods together. Most people just use one thing. They may just use physical activities like occupational therapy. Some people may use music. Some people may use eyes or vision. Some people may use nutrition, or they may use academics or behavior. What I did was combine all of those together in one program, but then it was all about directing it towards the weak areas of the brain, which is another thing that's different. Many approaches, they focus on the child's strengths, and in doing that, you actually make the imbalance worse. And they do that because they don't understand what the problem is. And so rather than just trying to address an individual symptom to get a child to write better or to try to improve their eye movements, where that is the goal, they don't understand and look at what's happening in the brain to cause that problem. And how does that relate to everything? Meaning that a child who has an attention problem may also have problems with handwriting or with their balance or with auditory or visual processing. They may not have a sense of smell. They may be a very picky eater. They may have digestive problems or immune problems or eczema or inflammation. How does that all relate to one another? Where is the main problem in the brain that links all of that together? And that's my approach. So the brain controls everything. So when there is a problem, you need to address everything, but you need to do it specifically towards the areas that are underdeveloped and weak. And when we do that in combination, the results are remarkable. They create changes in the brain that are like nothing that really has ever been seen before. And there's ongoing research right now at Harvard Medical School in the United States, at McLean Hospital, which is the #1 psychiatric hospital, using brain imaging studies on my work that's in this book, on the exercises that are in this book. And it's showing changes, physical changes to the brain that has never really been seen before. So we know that we are actually creating the changes, and we're seeing changes to only one side of the brain. So that we know that everything that I've talked about in this book and everything that we see in the improvement in children is actually reflective of what's happening in the brain. So this is why we are getting results, and this is what is so new. And there have been, like Dan Goldman and other top researchers that have said, this is the first new approach in really education or mental health in over 50 years, because everything else has really been basically the same approach. Using medication, using behavioral interventions, trying to really just compensate for the problem. This was the first approach that said, this is the problem and this is the solution, and directed towards that.